I've discovered that when people have nothing to lose, they are sometimes the most authentic and honest and beautiful human beings that you can encounter, because they have nothing to prove. They have nothing to hide anymore because it's very obvious. And that kind of vulnerability, I thought, needed to be treated with utmost respect. We are politicizing things that can help others, and that is not okay, right? That's not a political discussion. These policies have long-term impacts on how we perceive and utilize treatment options.
Hi, Dr. Melina. Thank you so much for joining me today at We Are Mentally United podcast. I really appreciate you being here.
Absolutely. Thanks for having me.
Of course. So, how are you? How have you been? How have things been for you?
Busy, but very, very good. It's always really wonderful to go to things like the Psychedelic Science Conference. And then, of course, when you come back, real life has to happen. So very, very busy, but very, very happy I got the chance to meet you.
Same, likewise. I'm just so happy that we got an opportunity to make so many different connections up over there, and our paths crossed as well for a project that we are working on together. But for folks who may not know of you, can you share a little bit about yourself, your background, where you're from, what profession you're in?
Absolutely. So it depends on how far back you want to go. So I born and raised in the western part of Washington State, and um, really, I guess, cut my teeth is probably the best way to say it. After bouncing around and traveling a little bit, started working in a crisis center. So I think it was the day after I turned 18, because you needed to be 18 to work there. And as you can
Wow.
imagine, not maybe the most appealing job for a lot of people. So started working in just a county-based crisis center for individuals that would come in for 1 to 5 days. Usually they were detoxing, often had a lot of co-occurring stuff going on. So either self-medicating for some mental illness or experiencing addiction and finding themselves slipping into a mental health diagnosis. But across the board, that was about the time when at least Washington State was saying there needs to be an umbrella that's just behavioral health. We can't do one or the other because they tend to always cross over. So I think that was the closest I got to really, really starting to understand those impacts of trauma. And I'm not sure who said this. I think it's been attributed to Russell Brand. So I'm really unsure, but I do like it. And he has something he said, which is the gateway drug is trauma. And that really, really stuck with me. And as I just matured and got older and went through a series of unfortunate incidences with my ex-husband, I started to really put the dots, in a line and go, oh, this seems like this is an area worth exploring, because if we really want to truly help people, we have to break these chronic cycles of trauma. And then, as I'm sure you know, working in the field, it becomes very, very apparent that it's not a one-size-fits-all solution. It's not a silver bullet. There's not really a specific treatment that can address all of those impacts and lifelong consequences of trauma, until I started looking into psychedelics. So fast forward a decade plus, and I am working in local government. I'm the interim Department of Human Services director, as well as being the assistant manager for the county. And it's definitely a lot, but it's also a place I see application of these principles and potential, especially as we look at the state being able to legalize and support healing centers for individuals. So I think it's been a really weird, long road, but like any choice in life, when you look back, it's just one straight path. So right now I am enjoying being done with doctoral studies and really being able to focus more now on the fun stuff, which is independent research and trying to understand the ways that psychedelic assisted therapy and this really, really wonderful, incredible medicine can interrupt those ongoing chronic cycles of trauma and really help people help themselves to have a better life.
Well, that's quite a journey, and I'll definitely have a lot of questions for you around the research and the psychedelic aspect of it. But I'm really curious to know a little bit more around what made you join that crisis center at the age of 18, because that's usually not something that an 18-year-old like prefers to do or is their first option. So what were some of those things that were happening up in that moment that guided you in that direction?
Well, sure. So I grew up pretty remote and rural. I was fairly isolated. I definitely experienced some early childhood trauma myself, and so it was it was an odd upbringing, I would say. And so there was a lot of there's a lot of sexual abuse in my family, and so when that kind of came to light, it was obviously very, very shocking and traumatic for my mother. And so, with the fallout of that, my biological father was incarcerated for a very, 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 very long time. And shortly after he left, my stepdad came in, and he was just a wonderful human being. And I know that he and my mom did their best with a ton of kids that had a lot of trauma. And so as we all kind of grew up, I was the youngest for a really long time. And about, I'd say 14, 15, really just started experiencing the normative changes of, going through adolescence, but really having some dissonance with my parents' faith perspective and feeling isolated and really wanting to just experience the world and see things through a different lens. That was not well received at the time. And so I ended up on my own at 16 and just kind of couch surfed, and was very fortunate to have some good friends and some parents of good friends that were willing to take in a stray. And I had one really critical thing, and I think that was a strong work ethic. I really, really like to work. And so one of my good friend's mom was actually the director of the crisis center. And I'd been doing odd jobs, doing what I could to finish high school remotely. And I completed high school, turned 18, and she said, I think that you might enjoy working in this crisis center. We definitely need someone. And so I kind of brushed up on what I might need to say in the interview, really not having a lot of experience in the field. And I remember my first day coming in, and I guess it would be important to remember too, I was very, very sheltered. So quite a religious upbringing. We didn't have television. We were pretty poor early on, and so not a lot of foundational things in the house. Like the roof needed to be put back on, and it was just a small rural cabin. And so I did not have a very wide worldview. It was a little odd. And my first day walking in, I walked in the back of the crisis center, the staff entrance, and there was a man in the kitchen, and he had his pants down, and he was doing his darndest to use the oven to burn off his private parts. And so I walked in,
Oh.
and my first response was, don't do that. and he goes, okay, and just like pulls him back up and walks out. And then in busts my coworker, and she's just pink faced, and she's got arms full of scissors and sharps, and she's like, we've got Jeff today, don't let him have anything sharp. And I was like, is that Jeff? And she says, yes, at least today that's Jeff. And I said, I think he was trying to burn off his penis in the oven. And she said, okay, Jeff. So that was my first introduction to the crisis center. And
Well,
it was definitely, it was different back then. That was 2005. And so there was a lot of difference in rules and regulations and qualifications for people. And so we just kind of did our best in that small crisis center to take in, up to, it was typically up to 12 people, but we really hovered around a good division between people that were detoxing and people that were needing subacute or just a step down level of care for behavioral health issues. So learned very, very quickly that I really, really enjoyed that work. I really liked trying to understand people that are having the worst day of their life. That was criteria for entering into a crisis center, right? 1 to 5 days. Hopefully we can detox you and stabilize you, and hopefully we can connect you to services. But really it was just that last step before either incarceration or those higher levels of hospitalization and care. So I really liked it, and I wasn't really sure why. I think I liked the intensity and the complication of everyone's diagnoses. Got really fascinated with how we can put a number to a mental health condition, and those numbers can change and the diagnostics can change. And so it was just fascinating. And people, I've discovered that when people have nothing to lose, they are sometimes the most authentic and honest and beautiful human beings that you can encounter, because they have nothing to prove. They have nothing to hide anymore because it's very obvious. And that kind of vulnerability, I thought, needed to be treated with utmost respect. And as a real sheltered, 18-year-old with not a lot of understanding of the world, it seemed like a wonderful place to just start, I guess, just dumping in very practical love, listening, understanding, and just treating everybody as though they're valuable. And so that I think was what kept me in the field. Definitely saw a need for more education. I had traveled and lived in Ireland for a little while, and I remember it was just teaching piano lessons to kids around Ireland and taking the bus and doing little piano recitals in what were usually castles, which was great, but they were usually like church affiliated residential areas. And so after a while, I really loved traveling and seeing Europe and making friends with different people and really trying to like blast open those doors of being sheltered for so long. But I would sit in a little cafe in Dublin and I'd watch people my age, really young adults, and they were walking into Trinity College, Dublin. And it just, something in me shifted. And I thought, I can't just bounce around. I need to have some sort of eye on education if I want to have any kind of life of meaning, if I want to be able to afford to live anywhere. And so ended up going back and enrolled in community college and started work again at the crisis center. I actually think I was rehired. I think it was in total of 3 times, because I'd work and then I'd say, okay, thanks, I'm going to go and travel. And then they were so good to hire me when I came back. I got to see the crisis center transition into a different contractor. And so that meant I got to be part of building up some of those policies and trying to keep them person-centered. Had a lot of faith in me from the new director, and he was really instrumental in just saying, I think you can do this. I'm just going to let you. And so got to build a medication-assisted treatment program for individuals with opioid dependence. And so did that in collaboration with a local physician, and really started looking at how do we keep people from having to go into this system? Because so many of the individuals that had those opiate addictions were typically people that had experienced injury. There were a lot of young veterans, and they would come in sometimes only 6 months after, a medical discharge from the military, and they would be horrifically addicted to pain pills because they were just prolifically prescribed, and then suddenly cut off when the magnifying glass got put on prescribers, and rather than a gentle titration or, hey, let's look at other options, it was just an immediate cutoff from these substances that were now really, really physically addictive for a lot of these people. So in a short window of time, you'd see people go from high performing and, really integrated into a specific way of life. And then just as a result of addiction, often not their fault at all, they would end up using whatever helped take the sickness away or the pain away. And they would come in just in that short period of time, completely different people, often morally and physically and emotionally destroyed. And so that medication assisted therapy was really, really helpful. We used Suboxone. And so it was really remarkable because Suboxone, with that, the approach with that medicine is to address the cause at a brain level, right? So peak withdrawal from opiates, that medication can often immediately take away those withdrawal symptoms. It coats those receptors so that they're not on fire from the lack of opioids, but it's also not habit forming, and it doesn't do anything if you don't need it and you're not in active withdrawal. So very difficult to abuse. And I think that's what really started getting me thinking, if these problems are brain-based and not just physical and not just behavioral, are we doing a disservice to people by withholding brain-based therapies? Because if you can give someone the tools and they can pick them up and use them, then you've got someone who's no longer a forever patient. You've got someone who's back, in the mix of real life. So, the natural course of careers, I think, it was not very predictable. I'd gone into human services for my undergraduate, learned a lot about service provision, and then thought, well, I don't think I can be very effective if people don't understand, how to deliver these services well. So went into adult education and got my master's in adult and higher education. And following that, began looking at positions outside of teaching. So I had begun teaching at a university in Washington and really, really loved it. Loved teaching human services, loved teaching, budding professional helpers the best way to help. And the best way to help is to not be a hero and to let other people be the hero in their own story. And that transitioned into being the programs director at a Job Corps center that was a pilot program. So that Job Corps center was, like many, many Job Corps centers across the nation, a place where youth 16 to 21 years old could apply. They had to be economically disadvantaged. So you saw a lot of youth come in that were long-time foster care, long sordid histories of abuse and neglect. Quite a few, and this may have been the nature of the programs. We had a pretty advanced IT technical program there. And so a lot of students that would apply and come in for the IT program and were on the spectrum. So that presented a different approach to education. And then really, really high levels of executive dysfunction. So ADD, ADHD, obsessive compulsive disorder. So a lot of youth coming in with tons of diagnoses and tons of, often substance use histories. And so when I was looking at classroom management there and the struggles teachers would have with these youth, that same theme started coming up again and again. And it was everybody with these struggles had trauma. And that really sparked in me this idea, well, if we can do solutions that meet the root cause where it's at, but the root cause is in the past, how do we do that? And, you can, of course, take one approach, which is just classroom management and trying to build up some of those cognitive flexibility skills, trying to downregulate heightened stress responses. But teachers aren't therapists, right? They're tasked with managing their classroom and imbuing education on people. So we started implementing some of those trauma-informed educational practices. And then COVID hit. And it was, for a residential program where these students who often don't have anywhere to go were faced with, well, now you have to leave. And so, really, it just was a hardship, I think, for everyone, obviously globally, but particularly for vulnerable and traumatized youth. Um, Losing that home base of consistency, I think, was a widespread issue, but particularly acute for this population. So, worked through that for a few years, then relocated here to Colorado and started working for CSU and Extension, and eventually transitioned into the governmental role. But at the same time, started my doctorate looking at, well, how do people change at a brain level? And how do we do that if there's trauma? And naturally ended up finding psychedelics. And so here we are, and a couple books later, but recent book about psychedelics and another one in the works, and really just hoping to be able to message out that this is a medicine and it needs to be approached differently than traditional medicines, because people won't stop having hardship. And if we can help them to not be forever patients, then that's the most important thing to do with my life.
Really appreciate you sharing that. That's a beautiful story and a journey. And while I was hearing you, I could relate to a lot of different things in terms of the trauma that you went through, the abuse that happened up. And it kept making me think about one thing, which is how life puts us through all these different challenges, but at the same time, there are these unexpected doors that open up. And we
Yes.
have to be prepared for those doors to open up for us so that we can take action when it happens. Because hearing from you, I'm pretty sure 15 when you were 15 or when you were 16, you would have never imagined or thought that you would be sitting up right here in this profession doing the work that you're doing right now. But you actually adapted and you took chances for towards the doors that opened up.
Thank you. Yeah, it does feel very much that way, right? Where you're not sure where you're going, and then your map is almost retroactive, right?
Mhm. I feel like a lot of strength also because in those moments, in those dark moments, things are really difficult, and we really feel like that's the end of the world in those actual moments. But then, if we are resilient enough, if we keep pushing, then there is light out there. There is brightness out there that we can expose ourselves to, and which is why being resilient in the name of trauma or in front of trauma, I feel like it's important, but sometimes it also comes with a lot of weight.
Yes. Yeah, and I think working in that crisis center was probably the best therapy that anyone could ask for as a teen, because you could very easily slip into that kind of egoic mindset of, oh, why do things happen to me? I'm so sad. But from that very first day, all I saw was people that had it way harder than me. And
Mhm.
so if they're still surviving, if they're still moving forward, then there's no reason at all that I shouldn't be able to do that as well. I have my physical health, I have my mental health. I, there wasn't there wasn't any comparison where I went, I've got it worse than you. And so you stop that comparative mentality, right?
Mhm.
Um, and people that experience hardship tend to be the most impactful at helping others because you've been there, and it's not the same, but
Mhm.
there certainly is a level of compassion, because 100% of every single person on the planet is going to have a moment or even a lifetime of, it's not fair, and it
Mhm.
isn't fair. And so weaponizing that and going, it isn't fair, what can we do about it, is that mindset for moving forward.
Definitely. And I feel like that mindset of moving forward, a big role that supports that mindset is psychedelics because of how it rewires the brain and how it affects the neuroplasticity of the brain. And you have mentioned a lot about it in your book as well. So can you reflect a little bit more about it?
Oh, yes, yes. So I think that first kind of insight happened when I was looking at ADD, ADHD. So I remember being 30 years old. I'd already had two kids and was a recent divorce and an adult. And I was looking at doctoral studies, going, I know, I tend to take on too much. I've got lists and sticky notes everywhere. I have a clock in every room, things that I thought were normal, and losing time often. And so that's why I had clocks in every room. So no matter where I was, I could see the time. Sticky notes
Were
for
you also an
days.
undiagnosed ADHD?
Oh, yes. Oh,
Because that
yes.
was me too. I figured it out
Yeah.
when I was 29 years old, and I was like, oh shit,
Yeah.
this is what it actually is.
That's exactly it. It's so true. And I mean, everything, right? Like leaving keys in the freezer, or like never could find my keys. And I did everything possible environmentally and behaviorally to address those kind of just functional issues. And then I realized I saw myself in all of those youth at Job Corps, where they couldn't complete things. They couldn't stay organized. They couldn't remember tasks. They had a hard time in stressful collaborations. They sometimes would perceive just normal interactions as being very, very stressful. A common theme was when a person of authority would hold them accountable, even in the most gentle tone, it felt like they were being screamed at. And so just looking at that and going, no, I observed that interaction and I saw you perceive that as aggressive and threatening. And I saw the instructor purposefully being calm and measured and really talking about the issue, not the person. I was like, there is a disconnect there. And of course, now we know that's a trauma response, right?
Hmm.
And so I started connecting that executive functioning with, seeing, seems like people with this diagnosis or these issues seem to have a history of trauma. So looking more at the neurobiological functioning of people with ADD and ADHD and finding that self-regulation, organization, cognitive flexibility, um, either hypo or hyper responsive emotions to stress, all of that seem to be located in those areas of the brain that lead to all sorts of chronic disorders later in life. So we know, of course, from the ACEs studies over the last, decade, 2 decades, that trauma impacts the body and the brain in a very, very long-term fashion, and it can
Mhm.
reshape how you respond to the environment, to the world, and there's a lot of excellent traditional and evidence-based treatments like cognitive behavioral therapy and all sorts of different approaches. But what I was finding as I was just doing this research was that for individuals with significant trauma, which significant with an asterisk, right? Because it's very individualized. You and I
Mhm.
could experience the same car accident, and one of us may have a very different response to that event. So, looking at trauma typologies, like, was this really, for example, girls, if girls experience sexual trauma earlier in life, sometimes their outcomes and behaviors are different than, say, a little boy that's experienced that. And so looking at the differences in those trauma typologies and then seeing that actually it's still all rooted in just neurobiological disruption. It's almost as if the circuit board for processing and engaging in life and relationships had some short circuits. And
Mhm.
so when I started looking at psychedelics, I think I had the same perception as many people, which was no touchy. What if you get addicted? What if this is just another drug? This is really woo woo. What if you have a bad trip and you go into psychosis forever? Um,
Mhm.
and the evidence for that was just not there. I had not been a big psychedelic person at all. Never done, like a hero journey or anything like that. The idea of being dissociated from my body and being very vulnerable and unable to control was absolutely terrifying to me. That was not something I was interested in.
Mm-hmm.
And the research just didn't support any of those fears or apprehensions. But what it did support was neurogenesis. So if I was looking at a short-circuited, motherboard, and then I look at psychedelics, those very areas that are so impacted by trauma events are the very areas where psychedelics can provide neurogenesis and repair. To me, that was no different than having an additional period of critical plasticity. So if we have that in early childhood, we have another in, early adolescence. And what we find is that even with traditional therapies at the adolescent period of critical plasticity, those ones can have incredible effects just given the developmental time period in the individual. So what that meant to me was we need another period of critical plasticity in adults. We need something that helps deconstruct those very, very concretized walls of functioning that have been solidified through trauma and survival. And if we can just make them squishy again, and we can help those, all of those synapses get healthier and start connecting and growing, then what that does is it allows that motherboard to be repaired. It's like a software patch. And so that just really, really, it's so exciting to me, because if we had a prescription medication that everybody feels more comfortable with because it comes from an MD or it comes from a psychiatrist, and we can say, here's your prescription that will help you release your past trauma, and it will allow you to look at stress events and relationships in a healthy, different way that you've not experienced before. We would have lines out the door, right? But as soon as you say psychedelics, people go, that's weird. I don't like that. Yeah. And so I think that's what is most important to me, is being able to find avenues and voices to communicate in the ways that people need to hear and understand, rather than trying to force a perspective or buy-in through other channels. So I think policy is probably a really clear example of that mentality. So when we're looking at policy development for not just legalization, but for access and use, I think that there needs to be a heavy education component to that. So for people that are in government, sometimes that's dollars. And so communicating that, we all know that there's about 10% of Medicaid, Medicare enrollees that will consume about 90% of benefits. And that's usually because, it's chronic, cumulative disease and disorder. And if you can't interrupt those cycles, then you have lifelong patients that are, for the duration of what ends up being a much shorter lifespan as well, it's always just kind of band-aids on bullet holes. And so from like a policymaker perspective, saying, hey, listen, you have all of these dollars just flooding into behavioral health and, and medication and addiction and trying to address substance use disorders. Well, what if we could just help people not have those problems anymore? The cost savings alone for returning to work, for being a functioning citizen, for being able to have an intact, healthy family, so you're not interacting with, CPS or APS, all of those things, just with a little bit of foresight, you can see that psychedelic assisted therapy becomes a widespread social prevention metric. So if you can prevent lifelong chronic disease, then you have nothing but cost savings for people that are chronically dependent on public systems.
Mm-hmm.
That's one approach, right? But if I'm talking to, a traditional therapist, then what I might say is, does it feel like your patients can only go so far with the tools they have, and then there's a setback?
Mm-hmm.
And so just trying to find those right avenues of communication, I think, will help people to understand the nature of this medicine and hopefully avoid putting it into the same category as traditional psychotropics.
Yeah, no, I very much agree with you. I feel like language is a very, very important component when it comes to psychedelics or when it comes to anything that has any kind of a taboo aspect in our culture. Because I feel like our brains, our minds have just been so programmed with what we have been taught for years and decades through media or through the textbooks that were that copy pasted everything that was being mentioned during the war on drugs, that our brains are just programmed in a way that whenever we hear psychedelics or whenever we hear, let's say, LSD, acid, Molly, anything of those things, it automatically releases a fear response. But if
Yes.
you just change it to, let's say, plant medicine or nature-based medicine, that triggering response is much lower, and people are much more receptive to hearing about it rather than in some cases just completely shutting down because of how, again, our brains have been programmed to think that way.
Yes, exactly. I was just reading I think it was first published in the 60s, but it's like a holistic plant medicine, huge book, right? So zombie apocalypse happens. I don't have to worry about connecting to anything. I can just open this up and I've got all these little natural solutions. And the book's not mentioning psychedelics. It's mentioning just holistic care. So looking at disease and disorder not as something to diagnose and use an outside in, but really trying to look at the whole person, their environment, their relationships, and going, your body has the ability to repair itself. So what can we do to create the healthiest possible body? And when I was reading through that, I thought, well, then plant medicine is psychedelic medicine, and that is addressing the whole body. We tend to look at our primary physical functions, and we separate that from our cognitive functions and our psychological functions, but they are all completely connected. And
Mm-hmm.
health in one area doesn't equate to health in all areas. And so you have to look at it holistically. And to me, psychedelic treatment or psychedelic plant medicine is taking a holistic approach to psychology and behavioral health and trauma-informed care. To avoid it or ignore it or demonize it is doing a disservice to everyone that could benefit from it. And really, that's pretty much everyone.
And I feel like a lot of people also have to look into the history of it, that where did it start happening up from? Because psychedelics have been used for hundreds and thousands of years. Since humanity
Yes.
existed, there are traces of psychedelic substances in old vessels, in religious practices, in community-based practices, in different ceremonial stuff that was happening up, and that was being that our ancestors were always engaged in. However, this whole hate dynamic or this demonizing dynamic is is not too old. It's only 50, 60, 70 years old, but the way it has been fed into our brains, the way it has been how the media has been used predominantly in really pushing down those guidelines and that knowledge has is what has really affected us, because whenever I look at psychedelics, I see it from the same lens as when I look at pyramids. Like, those things have existed since thousands of years. We just don't know what happened up with the pyramids and how did they come along. And similarly, we just have forgotten and lost touch with this technology, which our ancestors have been using for hundreds and thousands of years to heal.
Mhm. Absolutely. And it is funny too, right? Because it's such a Western ideal to go, oh yeah, yeah, we know it's been used for tens of thousands of years, but we discovered it just now. Like that's silly. And I think it's the wrong approach because if you have I mean, up to tens of thousands of years, right, of known use of this medicine, the knowledge base surrounding that use and its outcomes, and just honoring it, it that tends to get lost when we think, oh, I own it. I can use this. I can do an outward in. It's a magic pill. It's a magic
Mm-hmm.
cat. It's whatever. You lose the foundational aspects of the medicine, which are inherently internal and connective. And
Mm-hmm.
indigenous populations have been not only aware of that, but completely immersed in that.
Mm-hmm.
And, if you think about the utilization in the Peruvian Amazon, that's been in a practice for so long. And there's a reason that people go and want to return to that kind of setting, because we crave, especially when we are feeling isolated, which is a huge issue today for people. We are craving connection and meaning and authenticity.
Mm-hmm.
And we live in a really, really consumer based culture where we are trained to think, well, if you have a problem, there's something wrong with you. So you need something from the outside to fix you. So maybe that's fame, money, maybe it's position, maybe it's medication, maybe it's, so all of these things are these really insufficient approaches to helping someone find meaning. And so I think that understanding from the indigenous perspective of, you don't need all of those things. Let's just look at our connection among each other and to the world
Mm-hmm.
around us and to ourselves. And that's not easy to do from a consumer based westernized culture.
Yeah.
We think that that's weird. And
Mm-hmm.
it's it's not, but we feel it's weird and it's uncomfortable. I think we are really uncomfortable being alone with our thoughts too, because
Yeah.
what happens if our thoughts aren't good? Or what happens if we realize, I don't think I've done anything that's worthwhile? Like, what have I done with my life? And so that fracturing of identity, that fracturing of purpose, that especially for people transitioning out of like high performing careers, you're left with this like hole. And that leads to all sorts of things, right? That leads to depression and other chronic disease and disorder. But to look at psychedelics as a restorative property rather than a fix, I think it helps empower people to realize, I think I had this healing capability in me the whole time.
Mm-hmm. Mm-hmm. And I feel like in today's time and age, we treat everything as a commodity, or everything as has a price value or some kind of a monetary value that we associate with those things, which is also something that makes me a little bit afraid when it comes to psychedelics and the future of it, because I feel like I treat psychedelics more of as guides, more of as something that's knowledgeable, that's powerful, that can help and assist us, but it should not be monetized, I feel like. Because with monetization, it the humanistic greed comes in, the humanistic more profit comes in, stakeholders come in. We know how the world runs, how the
Mm-hmm.
industries run. So when they start coming up into this pure field, that's where I feel like that term that you used, magic pill, it's a marketing tool
Mm-hmm.
that you use it, you take
Yes,
it once and you're good to go. But at the same time, there has to be some sort of overlook on around all these things, so that something that's helpful does not get abused and does not like get banned again, or does not get misused in some areas as well.
absolutely. And I share that apprehension as well. I always, when I was teaching, used to ask people or ask students in the classroom, and these were adult students, what do we consider as a human right? And we would always come up with kind of the same things, right? Like clean water, access to nutritious food, um, a safe place to sleep,
Mm-hmm.
medical care, and so and education, right? And I said, well, of all of these things, are any of them free? No, right? They are not free. And so if we look at our basic human rights, are held behind a paywall, then if we also consider mental health treatment as a human right, which I do, then putting that behind a paywall through needing a primary care physician, needing a prescriber, being, held to the fire by pharmaceutical companies and all of their investors that are, operating under a mandate to make profit. All of those things are going to just continue the problems of providing human health,
Mm-hmm.
but limiting access to it. So to me, yeah, it needs to be absolutely free. It needs to be particularly for our most vulnerable populations, like veterans. There's
Mm-hmm.
no reason at all that the VA should not be really thinking critically about covering psychedelic assisted therapy in whatever venue and method the veteran prefers, because if that can disrupt cycles that lead to early death and family dysfunction and abuse and mental illness and substance use, then A, it's cost savings for the VA,
Mm-hmm.
and B, it actually does what we all claim to do, which is support our veterans. But
Mm-hmm.
if we're not actually supporting them when they're done with the job that we have asked them to do, then we're not supporting veterans. We're
Mm-hmm.
supporting commodities that we send out into the world for profit. And it needs to be a really hard look at our values as a society if we are continually saying, well, maybe we'll legalize this, but it'll have a cost. Or maybe we'll allow this treatment, but we're going to do it our way. It needs to be generative from the people and populations that are accessing it. So
Mm-hmm.
however that needs to happen, it needs to happen. And I'm really, really hopeful that because this has become such a bipartisan issue, particularly centered around veterans, that we'll
Mm-hmm.
have some powerful veteran voices coming forward and saying, put your money where your mouth is. If you really care about us, and hoorah, we are supporting veterans, then support us when we're done doing the job for you, because we're supporting the person, not the function.
Mm-hmm. And I feel like that's something that really bothers me a lot because, as you said, uh, when when men and women are young, when they're able to perform, when they're able to function and go and fight all these wars around the world, they are used very quickly by the government, by the country. But when they come back home as completely different persons to when they went into that battlefield, there is very less support and less consistent support, I would say, for the same people, which damages their families, damages their livelihoods, and in a lot of cases, they end up taking their lives because, like, around statistically, around 20 to 25 veterans take their own life every single day in USA, which is a shocking number. Shocking number to
Yes.
talk about when these same people are the reasons why a lot of Americans are safe today because of
Mm-hmm.
them putting their lives on the line. But when they come back, it's like I just dislike it a lot in terms of how they're treated. It's very much similar to how children are treated. Women are
Mm-hmm.
expected to bear children under all circumstances, and they're even in cases where there has been rape. But when the child comes out in the world, there is very less support for the mom and the child. Whereas there
Yes.
should be more and more support in that regard. Similarly, there should be more and more support when the veterans come back as compared to the support that they receive just to go up over there and fight the war. So,
Absolutely. And those major life transition pieces are a point of interest for me. So, some research I'm working on right now is looking at two distinct high performing populations, and that is special operations forces. So really elite military personnel and looking at NFL players. And when you do side by side of outcomes for those high performing populations, they have almost exact metrics when it comes to domestic violence, when it comes to substance dependence, when it comes to chronic pain. Both are in one way or another. Both populations are warriors, and we celebrate them and we venerate them and we build them up and we put billions of dollars into their performance. And then when they are done performing for us, whether it's on a screen or out across the globe, we have almost no care whatsoever for that transition between high performing identity and then now what? I've invested everything. My entire life has been this goal. And now I got there, and maybe it wasn't quite what I thought, but I know I should be grateful because I've had so much invested in me. But that transition piece is just such a distinct loss of identity and often meaning, because the entire life leading to that point has just been focused on that goal. Like when we transition out, that's when you see all of those problems really start to come to a head. You look at the increased rates of suicide, looking at traumatic brain injury and that impact on living. And then you often see those really high performing athletes and soldiers craving going back into the field, literal or figurative, because that's where it makes sense.
Or using alcohol or using other
Yep.
drugs to numb down that feeling or to numb down those urges.
Yeah. And trying to navigate those feelings of, I am home, I'm financially secure, I had a wonderful career. Why do I really not want to be with my family? I don't understand that. Or why do I feel ungrateful? I feel like I feel ungrateful because I've had all of this investment in me and I'm not happy. And so specifically with those populations, I'm talking to people that have experienced that as they transition, and the impact that psychedelics has had on their ability to transition into a different kind of life. And for those I've spoken to this point, it has been just remarkable. And I think that probably the biggest takeaway so far has been your meaning is derived from something other than what you do. And while what you do is important and it forms a lot of your identity, that meaning, the most protective factor for you to have a happy, healthy life is to have intrinsic purpose. And I see psychedelics as restoring that, almost going back to the basics of, isn't life beautiful? What would you like to do in it? And so it's impactful, but the biggest impact, I think, will be those voices that are not people we see as broken. They are not people we see as deficient. We venerate them and we say, I could never do what they do. But if they can be voices saying, yes, you're right, I did something really, really incredible and really, really difficult, and I was still empty, and this is what helped me. That's a completely different message than saying, well, yeah, I was homeless and addicted for a long time, and then psychedelics really helped me turn my life around. Equally important, but sometimes it's not as powerful to hear from someone where you're like, well, I think I could probably overcome that. But when you look at elite performers, you kind of know there's no way I could have done that. So I think those voices are really, really important. And I think moving forward, they're going to be more impactful for messaging that it's more than a treatment. It's a reestablishment of a role in life.
No, I completely agree with you because, again, we have heard so much negative stuff about it that it's really, really, really important to hear such voices, hear such experiences, so that again our brain gets rewired into in a different way. Which brings me up to the same point, which is that the Western medicine, what it does basically is it masks up the pain, whereas what psychedelic does is it actually helps you reflect and helps you rewire those damaged up areas.
Oh, yes. And to explore the dark corners, right? The alcoves and nooks in our minds that we are protecting ourselves from. And so we keep them, opaque. We don't want to look at them. And
Hmm.
it reminds me, one of the individuals was interviewing for the last book was um, she had an aha moment is of course a silly thing to say in this context, but she had struggled for a really long time, had a hard youth, was drinking very, very early, experiencing a lot of eating disorders, kind of was able to rally a little bit and go through school. And so she had a job in a medical profession where she was traveling a lot, but all of it served that kind of trauma mindset, which was I can leave anytime I need to, and I'm certainly going to leave before anybody hurts me.
Hmm.
Because she was carrying a lot of that from just her childhood with her mom in particular. She had encountered psychedelic assisted therapy like a little bit later in life. So, 40, between 40, 45. And it was a last ditch effort. She was drinking so much, she was not able to really function. She wasn't able to perform her job. She was having some job security risk, had no meaningful relationships. And so she thought, okay, this is my last chance. I've tried everything. I've tried traditional therapy. I've tried medication. I've tried so many things. And so she went in to a clinic for, a lot of pre-work, and that's very, very important, right? Let's set up what we are going to be examining and just practice being open. And this is what the process looks like. And during her first journey, she said she went in going, all right, I'm ready to have conversation with my mom. Like in my head, I'm going to work through these things, fully believing that was the root of all of her issues. And during that first session, she had shouted out a name. And when the session was concluding, the clinician said, can you tell me about this name that I heard you shout? And she just burst into tears. And she said, I went into this thinking I was going to have a real come to Jesus with my mom. And that name you heard was a wonderful man that I met when she had met him when she was early 20s. And he was older than her, but a very stabilizing, kind, compassionate person that just really, truly, he loved her. And that was very uncomfortable because she'd not experienced love that was not transactional or temporary. And it freaked her out a little, but it also felt good. And so she was probably the healthiest she'd really ever been while she was in a relationship with him. But shortly after they had gotten together, he experienced a terminal diagnosis. And her response was, I knew this would happen. I have to leave before you leave me. And so she left, and then he died. And that's kind of when all those problems came back and even more severely. And so in that session, she didn't encounter her mom at all. She encountered him. And all he said was, I am okay. And you are okay. And I understand. And you need to just move on. And it was like a light switch. From the end of, I think she had a total of 6 sessions. From the end of that session and moving forward, She had dramatic reduction in cravings for any kind of alcohol or substances. She was able to um, interrupt a cycle of really severe bulimia that was actually having esophageal impacts on her. She became high performing in her job. She established really, really positive relationships, repaired a lot of historic relationships. And in her mind, it would never have happened, ever, if I hadn't gone and shown a flashlight into those dark corners, because I've been treating the wrong problem. It wasn't about my mom. It was about how I made the biggest mistake I thought of my entire life. And you can't achieve that with many other types of medicine or treatment.
Wow, that's really, really, really powerful. And it made me think about something that I experienced in one of my journeys with psilocybin, which was about I remember I was sitting by a river and I was just thinking about a lot of things that I am fearful about, a lot of things that make me anxious, a lot of things that make me nervous. And there was this, it's very difficult to describe, but the feeling that I received from that journey was about how human beings have always been programmed towards different fears. And that's how our brains have always developed. So like thousands of years ago, when people were out there in forests trying to survive, their brain was always dependent around those survival instincts and keeping them safe in different situations. However, now that human beings have evolved in so many different ways, those demons or those kinds of scary aspects still exist, but now they have become much more internal around societal norms, around what people are going to say, around how should I react in this situation, or around how we get hurt from other people in either childhood or as we are growing up. So it's just our way of not thinking about those things constantly is a way of keeping ourselves secure. Just like back in the past, not going into those dangerous settings or those dangerous places would keep us secure. So our brain is just keeping us secure from our own self by not making us process those things or think about those things. But when you process those things in a safe environment, like in an assisted therapy environment, it's very impactful. But you can have that same processing journey when the setting is not right, when you're probably by yourself or when you're not in the right mindset. You can have that same exposure, same experiences, but it might have a very overwhelming experience or might be considered as a bad trip as compared to when you're having it in a proper set and setting.
Yes. Yes, absolutely. And that's definitely one of those concerns too, right? When we're looking at just utilization of medicine. So we're looking at when we call it recreational, that's to me that's okay. It makes me a little nervous because it's not escaping.
Mm-hmm.
And usually that's what we mean by recreational use is we want to escape for a little bit. I would
Mm-hmm.
say that, this medicine is the opposite of escape. And that alone changes the approach to the medicine itself, right? I think that is how you
It's
end
like a
up with
mirror.
those.
It's like a mirror. It
Yes.
shows you your reflection rather than a foggy mirror, which is what people are seeking up for when they go and they seek alcohol or cigarettes or things like
Hmm.
those.
Exactly. It's true. It is very much like a mirror. It's almost like when you're in a changing room and there's many mirrors and you go, "Oh, I didn't know I looked like that from that angle." And
Yeah,
that's
yeah.
very much what it is with a journey, right? You're going, "Oh, I did not look at myself from that angle." And
Mm-hmm.
it's meaningful. You can't always achieve that if you're not being very intentional and very vulnerable about wanting to look in that mirror for accuracy.
Yeah, definitely. And like you've been doing a lot of research around it. Can you share a little bit more around what positive stories or journeys or just statistics that you may have noticed on how psychedelics is making up a comeback and is bringing up change in a lot of these different lives that people are living and struggling with?
Yes, absolutely. So we can definitely looking at different categories of chronic issues. So when we're looking at substance dependence or substance misuse, if we're looking at, so those are kind of compulsive, right? So addiction tends to be very compulsive. You've got that little cluster of cells in your brain, your nucleus accumbens, right? And for just generally, it's your teeter-totter inside of your brain that is, what motivates me to pursue something, and then, what inhibits me from doing something or avoiding something. So if you look at issues of addiction, if you have had developmental trauma or acute trauma, you are in this mode where your teeter-totter is imbalanced, right? The bad and the avoidance thing is so heavy. And so in order to get to a point where you feel like you have any sort of happiness, or you want serotonin and dopamine to actually do something, so we see, well, tell you what does a lot of that: drugs. So you have a temporary false dump of, happy feeling chemicals. And for a little bit, it'll flip that seesaw so that you're feeling really good. But the problem with anything that needs to maintain balance or homeostasis is that any extreme will lead to another extreme. And so now you have this back and forth, and it's always trying to chase balance. And it's just not available if that teeter-totter is going bananas. And so when we look at eating disorders, when we look at the impact that deep brain stimulation has on eating disorders, we can actually see that psychedelics have a greater impact than even deep brain stimulation, because that's still an emerging practice, right? It's still a little bit of a neurological poke and find out. And if we have that kind of impact from an inward outward, then we're looking at less invasive treatments for interrupting those cycles. And then there's not dependence upon it later, because you're repairing the structure that was leading to that imbalance in the first place. So when we look at issues of depression, particularly major depression, and anxiety, like pervasive anxiety, not, oh, I'm nervous to talk to this person, but I am so anxious all the time that I am flooded with cortisol and I can't function or make good decisions. It's not about trying to stack the side of the seesaw with medication and, impulsivity and delicious, processed food. It's about saying, let's just reset that teeter-totter. Let's reset it so that it's not so frantically trying to rebalance. When you look at rates of addiction and outcomes following psychedelic treatment, specifically things like Ibogaine, it is, I mean, incredibly powerful. The efficacy of utilizing, I'll just use Ibogaine as an example. The number of individuals struggling with substance use disorder, regardless of the substance, even a singular journey with Ibogaine produces incredible results, often tipping past an 80% non-relapse rate. So if you compare that to any other kind of therapy or medicated intervention, A, the timeline for recovery is far longer, and B, it's usually punctuated with relapse, repeated relapse, because the actual issue was never addressed. And looking at PTSD, that's a big one, right? Especially complex PTSD. If you are looking at veterans in particular, there was a slew of studies that I was reviewing that were global, because obviously there's less studies on things that are illegal. And Brazil in particular has been very, very open and liberal with their, not politically liberal, just the actual word liberal, with their widespread sanctioning of psychedelic use. And for many, many of the veterans that come to South America in particular, the diagnostic criteria for PTSD, there were across the board, there was an average of about an 82% you do not meet criteria for this diagnosis anymore. And this
Wow.
was across multiple studies, touching on ibogaine, ayahuasca, psilocybin, ketamine, and MDMA. And the efficacy of that cannot be underscored enough. When you compare that to traditional therapies, there is no comparison. And I mean, it's just, to me, that speaks volumes. But I think that it's also important to know numbers are not people, and the impact that it has on people is exponentially more. So one wonderful friend that we have, my husband is a veteran, special operations veteran, and so you can imagine it's close to my heart. But we had a friend that was just struggling. He was kind of the same story that you hear a lot, not to say it wasn't unique to him, but struggles with alcohol, struggles with identity, struggles with family dynamics, feeling angry all the time, feeling tired, not making good, healthy food choices, not sleeping well. And then he was on a slew of psychotropic medications and was just like, I feel worse. Like, this feels worse than anything. And it's like all of that depression and anxiety and PTSD was masked at best. And it still was bleeding into everything. So he made a very, very hard choice. He had not been exposed to psychedelics, was real hesitant around anything, had a mindset of, I've been clean, I don't want to get addicted, I don't want it to do anything like that. And he was able, under medical supervision, of course, to decrease and eliminate almost all of those psychotropics, began just microdosing, and found that even without that huge hero journey or, some big cathartic experience, just that restabilization through microdosing was able to give him that firm footing to start repairing all of those relationships and habits and retaining a better sleep schedule and being able to self-regulate more, to a point where it didn't have to be a massive, epiphany experience in the jungles of Brazil. It was just enough for him to go, oh, I think this is better for me. And he's been doing phenomenal for a very long time now. And it's not because it was a magic pill. It was because he just needed that extra footing to do the hard work himself. And I think that it doesn't have to be a throw your clothes off and go live in the jungle. It can be a self-directed therapeutic tool.
No, definitely. And thank you so much for sharing that story as well. Because again, I feel like people need to hear more about around these stories. And I would also encourage all the listeners to do your own research. Like, look up at the latest research that's happening up around ibogaine or around psilocybin and addiction, or what's happening up in Mexico or what's happening up in South Africa, and how a lot of these countries outside of the US are providing such immense amount of support to the veteran population, and to the population who are struggling with really, really severe challenges, or have been struggling for severe challenges for decades. Uh, Making up this documentary, speaking with so many different people, veterans, it has just opened up my mind and just blew my mind in so many different ways on how a lot of these individuals have struggled with this treatment resistant depression or treatment resistant PTSD, or have had constant relapses with their addiction journey, and how couple of psychedelic assisted therapy journeys have completely transformed their lives, with ibogaine being used in Mexico, or with psilocybin, LSD being used in South America, or in South Africa, or other parts of the world as well. It's very informative, and again, I always encourage people not just to believe on whatever they're hearing, but do your own research, because you'll find the answers.
Yes, absolutely. And to even just take a minute to go, okay, why am I immediately poo-pooing this? and looking at just the gross misclassification of these substances, to be
Can you talk a
scheduled.
little bit I was just gonna say, can you talk a little bit about the Schedule 1 drugs and how obnoxiously weird it is that they're scheduled in as Schedule 1 drugs, but there are a lot of other things that should be in that category that are addictive, that are harmful, but they are being widely used, like a lot of the pharmaceutical drugs or a lot of opioids or alcohol.
Yes, yes. So this is an area that drives me bananas, right? Because I do work in local government, and so I do see policy that's at federal and state level and local level, and these policies have long-term impacts on how we perceive and utilize treatment options. So I mean, high level, for something to be a Schedule 1, there needs to be a high potential for abuse. There has to be no accepted medical use, and there has to be a lack of accepted safety for use under medical supervision. So if we just look at psilocybin, high potential for abuse. So what that's talking about is addiction, right? Is it going to
Mm-hmm.
be something that people are going to begin abusing and then be unable to stop? No, it is not addictive in the sense that your body is not going to go, oh, I really like psilocybin, I need it now, or I'm going to withdraw. That is not the case. It is not any kind of, it's miles away from being physically addictive. No accepted medical use. We've already discussed, for over an hour now, that there are very, very distinct medical applications for this, especially for addressing all of those behavioral health issues that tend to interact with physical chronic health issues. So that one's out the window. And then that lack of accepted safety or use under medical supervision, again, not an issue.
Mm-hmm.
For the most part, if you do have someone facilitating, that is excellent. That is best practice if it's going to be a really vulnerable journey. But it's not something that you are going to overdose on and then die. It is not, at worst, it will be uncomfortable. And the number of recorded overdoses for psilocybin is nothing.
Mm-hmm.
You could have underlying conditions, which would be the same as if you had underlying conditions for anything, and you are smoking pot, or you are drinking alcohol, or you're taking barbiturates, or any number of prescribed medications. They can have a much more significant impact on unmasking underlying issues than psychedelics would
Mm-hmm.
have at all. And so when we look at those three requirements, why are they Schedule 1?
Makes no
We're not
sense.
even, yeah, it
It
makes no sense.
And
It's
it
not
stops the
even,
research too, because like
yes.
as it's Schedule 1, you cannot, like, researchers like yourself cannot do any research on it.
Yep, exactly. So it stops research. It also stops funding. So when you
Mhm.
have something as a Schedule 1, even if you have a really interested private benefactor, you're still encountering legal issues because it will not be sanctioned. It'll be illegal to be utilizing these medicines without, the governmental blessing. And so I equate it similarly to like stem cells, where we can, harvest them in the US, but we can't inject them in the US. And so people are having, again, to go outside of the country
Mhm.
to access care that is generative, and it's person-based, and it has wild efficacy. There's no reason, even by the guidelines set forth by the US government, they're not even following their own guidelines. And
Mhm.
so I think just introducing some logic in policy would be very, very nice. And then a reexamination of those scheduled substances, because there are a number of substances that are not Schedule 1 that have high potential for abuse, are not safe without medical supervision, and you absolutely can overdose on them.
Mhm.
So if I look back at the working in detox at that crisis center, we had a couple of hard lines for intake. because we were subacute, right? And so we could not take in anybody that was actively abusing or dependent on benzodiazepines. So those are pretty commonly prescribed for, anxiety and, sometimes for withdrawal from alcohol. And so benzodiazepines pose a huge risk for withdrawal, and it can lead to death. So we would not take people that were prescribed benzodiazepines. And then, excuse me, if they were prescribed that and they were not abusing that and they had their medication, we could. But it was a hard no because of the medical, the medical impacts of just having that leave your system. And I just wanted to double check because I wanted to make sure that I wasn't misspeaking.
No, you're good.
Yeah, so benzodiazepines are a Schedule 4.
Okay.
That doesn't make any sense.
That makes no sense still, yeah.
It makes no sense. And then, and just like alcohol alone, that's completely legal, right? And there have been lifelong destructions and deaths and from alcohol and alcohol withdrawal. Again, we had to have a threshold. You couldn't be above a 0.25 when you came in, because above that you could have seizures and die. You need to have medical supervision. Alcohol
has literally damaged so many families. It has literally damaged like our society in such negative ways, but it's still socially acceptable within our community. Same thing for the pharmaceutical drugs, because I feel like at one point your body becomes used to it, and then the only next step is to add another medication to it or to increase the dosage. And it's not a good long-term solution in the end, whereas psychedelics is something that really problem solves that aspect of it. But in terms of policy making, or in terms of the future, where do you see the psychedelic movement heading towards? Because there seems to be a lot of promise with the current administration, with what Robert Kennedy recently mentioned, that they're trying to push it forward and expedite the whole psychedelic assisted therapy, especially for veterans, within the next 12 months. So what are you noticing right now? Where do you feel like this movement is heading?
I think that it's got a good head of steam right now, which is excellent. I think that there needs to be a bookend approach to the widespread utilization of psychedelics as treatment. And I think that those bookends include just popular education, right? How do we help the population understand what these are, why they should not be Schedule 1, and just really meaningfully approaching the public with actual credible information so that we can make our own decisions about that. I think in any kind of political climate, especially in our political climate right now in the US, we are politicizing things that can help others. And that is not okay, right? That's not a political discussion if people deserve to have care and health. That's a given to me. So I think preparing the just all of the population by giving them excellent information in a way that is understandable and accessible, and it's not behind some highfalutin paywall, and it's not behind a bunch of ridiculous, peer-reviewed academic articles that everyone's only going to try and read the abstract anyway. But it's just meaningfully integrated into our understanding of how to access healthcare. And then that other bookend, right, is we need to educate policymakers, because with that much influence on being able to move something forward or withhold it from the public, there has to be an understanding of what this is, how it can be helpful, and there has to be some safeguards put in place so that it cannot be capitalized upon, it cannot be withheld, it cannot be misrepresented for political agendas. And so I think those two bookends will serve as some really soft, supportive hands for everybody that really could benefit from this medicine. And I'm hopeful that as we look at the just really, really horrific nutritional standards within the US that we are finding have led to a series of really, really terrible metabolic disorders and even behavioral disorders. If we can start to look at that and get more of an understanding of, I think our bodies and brains are systems. And if we introduce toxins to our systems, then our systems don't work very well. Well, let's apply the same thing to medication. Let's apply the same thing to all of these methods of care. Again, let's look holistically at who we are, our environment we live in, the relationships we have, and let's not forget about our neurobiology and our physical biology and the interplay between all of that. And so I do see this movement toward health being very, very helpful. I think podcasts like this, right, where it gets the message out in an accessible way, and a lot of podcasts. We've seen this just in the last, I'd say, 5 years. There's been an explosion, right? And so people are able to access information and education in a way that makes sense to them. And there's no judgment, and you're not getting sat in a classroom and saddled with debt to access this information. So I see this as a prime opportune moment to be able to get those bookends in place, and let's get the word out. Let's make it meaningful and accessible and decrease those apprehensions about it through education. And on the other side, let's inform our policymakers and then hold them accountable for doing what they are elected to do, which is to represent the needs and the will of the people.
For sure. I couldn't agree more. I completely agree with you. I feel like education is extremely important, and so is podcasts, documentaries, more conversations, more awareness around it. Just 2 days ago, I saw Paul Stamets being on Joe Rogan's podcast talking about how psilocybin is affecting and the latest research that's happening up in the psilocybin world, which also really opened up my mind towards another thing is psychedelics and religion, because he was talking about how there have been lots of religious people who have used it in the past, and recently John Hopkins did a research where they had people from different faiths, from Muslim faith, Christian faith, Jewish faith, and Buddhist faith, and they made them go on psychedelic journeys. And the response that they received from that research was their own relationship with their religion increased when they were on these journeys, and it deepened up that self-love, it deepened up those things. So it's not just helping people overcome their struggles, it's also providing a different way of life, a more meaningful way of life, a deeper connection with God, deeper connection with the spiritual world, with the cosmic world, with their own self. So I'm very excited to where it heads. I recently, couple of years ago, I guess a year ago, there was this press conference that AOC did with Dan Crenshaw, which I feel like was also very powerful because it basically reflected of how big of a non-partisan, bipartisan issue that this is. And I feel like there needs to be more unity, more people coming together from both sides of the aisle, talking more about it, reflecting more about it, so that it goes a long way, because media and politicians have played a huge role in demonizing it. And I feel like media, policymakers, and politicians now need to step up again and play up a bigger role in accepting what went wrong decades
Yes,
ago.
absolutely. Absolutely. Because it is need is ground up and policy is top down, and they do not meet in the middle if there's not communication. And that communication comes with bipartisan discussion and the removal of the ego from these kinds of discussions. I think there's been a couple of people who've said this, but I absolutely support the idea of, if you are going to go into some sort of political representation of individuals, one of the best things you can do is experience a psychedelic journey so that your mind is open and available to other perspectives, and you are not making decisions based upon your own biases and internal egoic needs, right? You are truly representing a wide swath of people.
I feel like it should be a mandatory thing for all politicians to
Yeah.
have a psychedelic journey before serving public office so that they can like liberate themselves free from whatever things that they're carrying or whatever misconceptions or whatever biases that they're carrying. But I know we are tight on time and I know we can talk about this for hours and hours, but I wanted to give you some time in terms of reflecting a little bit about your book, The Reset, what it is about, and also if you can talk a little bit about some future projects or your future books that might be coming up for the audience to know.
Yeah, absolutely. So the reset, I think there's probably a couple books with that and different subtitles. So subtitles, treatment, it's oh my gosh. So the reset is trauma, treatment resistant disease, and how psychedelics can save America. And so that work was largely derived from the qualitative research I was doing with patients that had a history of trauma and were 6 or more months post treatment. So I wanted to look at how their lives were different. And so a lot of the book is talking about just trauma itself and the neurobiological impacts of it. And then looking at these stories of individuals who have had profound experiences of healing and an actual reset in their minds and their bodies and their brains as a result of this therapy to lead healthy lives. And then, there's a special chapter dedicated to veterans and really a call to action for education and advocacy. That book was a pleasure to write. It was a lot of years of research for the educational component of it, but really, I think the power is the lived histories of people and being able to see yourself in their lives and seeing the outcomes. Next project underway is tentatively titled Elite, right? So Elite, ELITE, and it's again talking about so professional football players and I'd say professional war fighters, and looking at the kind of people that go into those professions, and looking at how high performing individuals, warriors in many sense of the word, right, transition back into a life of meaning and worth that is not entirely rooted in that performance identity. And that's achieved in this case through the use of psychedelics, whether it's going independently down to Peru to engage in some ayahuasca ceremonies, or it is finding a trusted facilitator and being in your living room. But really, this is about capturing those stories without the heavy scientific elements to it. But, probably the public won't know very many of the elite war fighters. I do have the benefit of access to these incredible people because of my husband. And I'm really hoping that those stories, there's, from Green Beret, Army Ranger, Navy SEAL. So looking at those really incredible people and getting their story about how much this has helped them to revitalize their identity, to restore their family relationships, to get out of cycles of drug use, and to really, really lead lives of meaning that are totally different than what they thought was possible. And then the same for professional football players. So I've had the pleasure of interviewing a couple to this point, and the similarities between professional football players and professional warfighters are really, really interesting to me. But it's the same approach. These might be more well-known names and faces. And so I'm hopeful that will capture a large portion of the American public, because we venerate and adore all of these people. So let's listen to their stories meaningfully and really take in what they're saying, because they have a lot to teach us.
I appreciate you sharing that, and really appreciate you doing the work that you're doing right now in terms of the research and how you're interviewing these people. Because again, going back to it, telling up and sharing these stories is super important for people to be educated around it, to hear these real life stories. And especially when it comes from veterans or when it comes from football athletes or people that people can relate to or people have an affection towards, I feel like the message then goes a long way.
I agree. Thank you. And thank you for giving me the opportunity to chat with you and share more about it. And it's just been a pleasure.
Of course. And like to wrap things up, if people want to find you, how can they find you? What are some of your social media links or website links that they can look up for?
Yeah, absolutely. So easiest one's probably just melinabricker.com, melinabricker.com. And that's just a website that I typically don't do much with on my own, but I do have a wonderful Kimura Trap Studios is the entity that created that. And so it holds links to resources, research, academic papers, all of the sources from my books, and then also links to the books and upcoming projects and social media. So I'm not great with social media. I have lots of other lives I have to lead, and that kind of gets put to the back burner, but that is the best place to access materials, resources, and me if you want to.
Thank you. Thank you so much for sharing that. And I'm also going to drop up all the links in the description of the video as well so that folks can reach out to you. But I really appreciate the conversation we have had today, Melina. I would love to have you back on the podcast whenever your upcoming book is close to its release, just to hear more about it, because I feel like psychedelics is a topic that we can talk hours and hours for. And although we have spoken today for like almost an hour and a half, I still feel like there is so much more that we can go into and talk about.
Absolutely. I agree. Well, I'm happy to come anytime.
Thank you. I appreciate you being here, and I wish you all the best for all the projects that you would be working upon. But again, thank you for joining us today.
Thank you so much. Have a good one.
Bye bye.